Welcome back to Executive Vision. The healthcare industry is at an inflection point.
Let's take a look at what's at stake for healthcare leaders and patients around the world.
Healthcare, perhaps the most important issue facing today's leaders, pounding at our human values, tugging at our heartstrings. Town halls across America are filled with passionate debate over healthcare reform. But lack of access to care is not just an American problem. It's a global ill, leaving the world's greatest leaders challenged to find the cure.
No matter what the situation is, the international community should treat this as a window of opportunity to ramp up preparedness and response.
The stakes have never been higher. Skyrocketing costs, pushing families and businesses to the brink of bankruptcy. Worldwide pandemics threatening millions. These are life and death problems that cannot afford to wait.
Fear is the #1 problem in what we call leadership today. And there's no way to make a decision and there's no way to lead.
Only through global cooperation can we fix our ailing system. Can drug companies, insurers, hospitals, doctors, corporations, patient organizations, and the government figure out a lasting solution when they all have competing agendas? The real question: can the greatest leaders in healthcare create a vision to make the system more effective, spur innovation, and leave a lasting impact around the world?
Tonight, we brought together healthcare visionaries for what we call an executive strategy session. Former Senate Majority Leader Bill FRIST is a heart and lung transplant surgeon. Now an industry investor, he also travels the world promoting global health partnerships. Under CEO David Snow, Medco spun off from Merck, and now the independent prescription company counts more than $50 billion in annual sales. Next on Snow's agenda, expanding worldwide. GERARD KLEISTERLEE is targeting healthcare as a key driver of growth at Dutch electronics maker Philips. Sir Bill Castell runs the Wellcome Trust in London, directing almost $1 billion a year into healthcare research worldwide. Bill George teaches leadership at Harvard and has written 4 books. He built pacemaker manufacturer Medtronic into a $60 billion business. All right, thank you all so much for joining us here today. We really appreciate it. Bill, let me start with you. Is there a formula in leadership for innovation?
Well, the best formula is to be engaged with your customers and to be engaged with your people. You can't sit back in your office. You can't just look at stats. You got to look at that too, but you have to be engaged. There's no substitute today.
What does that mean, though? Do you go out and talk to them? Are you in constant email contact? I mean, engaged is a word, is a big word. How do you do it, really? Well, when I became CEO of Medtronic, I gowned up. I saw over 1,000 procedures in 12 years. We actually went into the operating room, worked with the doctor, said, just teach me. I wasn't trying to sell them. And I remember one doctor, one of our products, as a catheter fell apart in his hands. He got so mad, he threw the thing at me, comes across the room, blood and all. He was so angry. But I'll tell you, got the message. We had a quality problem, and we had to go back. It was a new product, and we had to get that product fixed. These things happen in healthcare. That was your product. You watched it fall apart in the doctor's hands in front of you. You bet. How'd you feel? Terrible. But I talked to the person who was working with the doctor, and he said, well, this happens regularly. And the people back at the home office didn't know anything about it. And it was all clogged up in the quality system. We had to get a much faster system of getting information right from the hospitals and the problems we had. So we actually went out and put in a system to collect that information and get it to us very quickly, rather than waiting for them to report to us.
Yeah. Well, listen, what I took just listening is you talk to your customers, and I would say you identified who your customers were, and I would go back even a step earlier. Who are your customers? Yes. A lot of people see the devices that's going to help patients. Let's go to the patients, very important. But at the end of the day, you went to the physicians. Who has the best interest of the patient? I think that's important for all of us as we look at leadership.
I think we have a very simple principle that drives our innovation, and it relates to what both of you have said. Our mantra is we help doctors provide better care for their patients at lower cost. That's what drives our innovation, and that's what sets our roadmap.
The way you get your company to innovate, once you've learned what your customer needs, is to embed in your employees a noble cause. Yeah. Because I find that I attract...
Really, not profits, but a noble cause.
No, yes, absolutely. You attract the best employees who have the real passion for your business if you embed in them a noble cause that you're all committed to.
Gentlemen, let me bring in our other guest, Myrtle Potter.
Yes, while I was at Genentech, of course, innovation really was the challenge, right? In any business that size, of that ilk, keeping a pipeline filled with drugs that are meaningful and can make a difference, that really is the #1 challenge. We gave our scientists a very defined piece of time, fully paid for by the company, to pursue projects in their own labs. And we used to call that opportunistic. Meaning that you never, especially with science, could predict exactly where the next big idea, great big scientific innovation would come from. But it does come from your employees. It comes from the experts.
Let me just talk about events more immediate, if I may, as the Northern Hemisphere goes into winter and we wonder what swine flu will bring us. We've got a recent poll suggesting that most Americans, 55%, would like to get an H1N1 vaccine if that were possible. I'm not sure whether that will play out in such a way in the United States. I mean, where do you stand on this, on these immediate problems, this greater interconnectedness?
We need to have more collaboration with industry, academics, and governments to work together to fight these kinds of diseases that are of significance globally. This is where
that's kind of a bottom statement.
Well, I think the WHO and the federal government can facilitate. This is a place where I think the private sector all by itself can't necessarily do it.
Bill, do you want to come in on this from London, because this is really your area, isn't it?
I think on swine flu, the industry's responded extraordinarily well. The challenge for us nowadays is the global pharmaceutical industry, and we have many of our leaders here. It is the global vehicle to answer the challenges of society. We have to demonstrate that we can deliver global health, and we have to use our skills to respond to that challenge.
I think there's a general understanding today, really what Sir William said, that we're in this community together, and viruses know no borders, infectious disease know no borders, and chronic disease. The field that I took care of thousands of patients, cardiovascular disease, lifting hearts out and putting them back in. What a terrible thing to do, take somebody's heart out, put it back in. We shouldn't have to do that. We've got the technology, we've got the science, if we can encourage that. But it's not just a problem here, it's a problem around the world.
But Dr. Cressey, I mean, you just got back from China. How do you go and operate and deal and push these ideas in a country that has totally different rules, totally different language? I mean, that is one of the biggest barriers that you all have to breach.
Where we might look in terms of person-to-person dealing about integrity, honesty, they very much look at the person, of face-saving, of respect for each other, respect for country. All of that is not typically what we do in terms of our negotiations, which are more numbers itself. People adapt to that. It takes the time, it takes the investment for people who have been there a long period of time. In truth, the markets are huge, and in terms of being a global economy, that's why many of the
I want to give you an example about Africa. We just announced a deal that the Clinton Foundation facilitated between us, 12 countries in sub-Saharan Africa, Clinton, and the Global Fund. And it's a commercial model, because at the end of the day, what everybody will tell you is that you can't rely on philanthropy, you can't rely on charity, you have to have sustainable commercial models.
Yeah. It's not just business, and it's not just government, but it's partnership of government, of business, of non-government organizations, of civil society, of recipient countries together.
We got to leave it there, guys. Up next, $160 billion. That's the amount already spent this year on big pharma mega mergers. Our leaders on consuming the competition when we come back.
Next, how David Snow is leading his company's fight against the competition.
We're very comfortable competing with Walmart, with CVS Caremark, with Express Scripts, with all of our competitors. I mean, that's what makes the private sector good. There is real competition. People have choices.
And later, noted business journalist and author Susie Welch is here with a leadership challenge for our panel.
You have 24 hours to get the situation under control.